Cheviot, Ohio was recognized as a city in 1931. The city of Cheviot is located on the west side of downtown Cincinnati, wedged between Green Township and Westwood. Cheviot takes up approximately 1.16 square miles of southern Ohio and houses roughly 8,000 people. Like most of the west side, Cheviot holds a large sense of pride in the community and is filled with families that continue to believe that the west side of Cincinnati is the best side. In doing this project, I identified the biggest strengths to be proximity to healthcare, as we're very close to Mercy West, proximity to grocery stores and food, and low overall morbidity and mortality. I thought it was also important to note that there is a very strong sense of community in Cheviot, which would be helpful when it came time to implement interventions. The biggest health risks in Cheviot are COPD, lung cancer, substance abuse, and sexually transmitted infections. After some deliberation, I decided that sexually transmitted infections were the priority problem. I chose this risk factor because untreated STIs can lead to further reproductive health problems. There are also several bars in the area, and the use of alcohol can increase risk-prone behaviors, especially in terms of sexual health. The goal I developed for this project was to decrease the rate of sexually transmitted infections in sexually active individuals between the ages of 20 and 24 over the course of 1 year. The objectives I created to go along with this goal were to 1. Reduce the rates of STIs in people ages 20 to 24 over the course of 1 year. 2. Increase the use of condoms in sexually active young adults over the course of 1 year. And 3. Increase knowledge regarding STI transmission in sexually active people between the ages of 20 and 24 over the course of 1 year. The interventions I came up with to go along with these goals were to 1. Work with local bars to distribute free condoms to patrons. If condoms are available, they are more likely to be used when individuals are engaging in high-risk behaviors for STI transmission. An example of such behavior is to use drugs or alcohol and then engage in sexual activity. The second intervention was a sexual education program for young adults, with the courses offered every month for a year, with a pre- and post-test to evaluate learning. The pre- and post-test will allow for evaluation of knowledge. These are both primary prevention strategies to help minimize the incidence of STIs among young people. Cheviot has several resources that would assist in this project, one being Pregnancy Center West. They provide free STI testing and condoms. There's also the Hamilton County Public Health Department. Their website has tons of information regarding STI transmission and can even locate free STI testing clinics near you. After establishing my objectives, I had to come up with a method of evaluation for each one. When it comes to reducing the rates of STIs in people ages 20 to 24 over the course of 1 year, the method of evaluation that I chose was using health data, specifically the rates of STIs collected at the end of the previous year, and compare that data to the end of the year after the program was implemented. And then we would look at, are there fewer overall cases of STIs in the community? For the second objective, which was to increase the use of condoms in sexually active young adults, you had to look at the correlation between the use of condoms and decreased rate of STI transmission. So if there was a decreased rate of STIs, you could correlate that there was an increased use of condoms. For the third objective, which was to increase knowledge regarding STI transmission in sexually active people between the ages of 20 and 24 over the course of 1 year, the method of evaluation would be a pre- and post-test, just like what was used in the education programs that we would implement. And so the scores of the post-test being higher than the pre-test would mean that there was an increase of knowledge regarding STI transmission. Overall, during this project, I learned a lot about Cheviot and the community, but I also feel like I learned a lot about what community nursing is and what the different roles and responsibilities are that come with it. I really enjoyed this project, and I think that it's a really great learning opportunity and something that we don't always get to see over our nursing careers.